just a second. Sorry. Are you there? Oh, snot.
It's okay, you still live. There you go.
Hold on just a second. Sorry. Are you there? Oh, snot.
It's okay.
Yeah, I'm here.
There you go.
I'm here.
Just a second. Sorry. Are you there? Oh, snot.
I'm here.
All right, so it seems like there's like a 2-minute delay.
Okay, hang on, okay, so tell us, he's got horrible it's like, yeah, it's bad.
Yeah.
This is only like the second time we've done this.
Yeah. So we're just gonna.
Did Joni have to dial in too, or
She's not gonna be joining. She's not gonna be joining.
not gonna be joining? Okay.
Okay,
Have to enjoy again real quick so you can see better.
okay, can you go ahead,
Speakerphone or?
can you go ahead and join in again? Justin's standing here, so if we have this issue again, then we won't have this oh Fred or oh snot, like I said earlier.
Okay. Sounds good.
At least everybody. Okay, thank you.
Bye.
This is the only the second time we've done this portion of
Yeah.
this.
We don't usually do it this way.
Shall we call meeting to order?
I followed the direction.
We'll do that.
Oh, there is back.
Jared, we're gonna call the meeting to order.
Okay.
Could we rise for the pledge of allegiance?
Okay, so what do you want? On the other one, well, we don't have it.
It's
Oh.
Allegiance to the flag
Of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call on this.
Dr. Turner.
Here.
Jeff DePass.
Here.
Dr. Todd. Here. Dr. Lim.
Here.
Dr. Ross.
Here.
Dr. Caddick. Here. Mr. McKenna.
Here.
Doctor.
No, it's not.
All right, and Dr. Ruckin.
So, were there any concerns about the minutes of the last meeting? If not, is there a motion for approval? So second. Second. So, motion was made and seconded to agree with the minutes of the last meeting. Is that all those in favor?
Aye.
Opposed? That passes. The financial report, Rhonda?
Okay, you should be able to see that. They're in the charge accounts. We did receive some homebound money reimbursement type stuff, so they put it into the general fund. Everything else, does anybody have any questions regarding this? And once again, I will explain that the immunization grant always shows, and also the health awareness grant is in arrears usually, because that is one where I voucher it down. And I send it to the state.
It looks like the healthcare grant ends before our next meeting.
I'm sorry?
The healthcare grant ends before our next meeting. Is that going to be an issue?
No, it should not.
Says on here, it's 2021.
I know, sorry.
Oh,
Well, that's
2021,
okay.
yeah, so
So
it's all
is
right.
it
They
2022
actually
though?
extended it
Okay,
to this year.
okay.
So it is good for right now. We are using it, regional hospital is doing that, and then, we're discussing the rest of that at this time. Joni's well aware of it.
Okay.
Any other questions or concerns?
Is there any COVID grant?
I'm sorry,
Grant from COVID fund,
the COVID fund is ended.
isn't it?
It did, they put in enough money for us to finish off the COVID with the, let me rephrase that. The commissioners had them put in so much money, we used all of that. And then we've had, other that we used when we received money from the federal government, the state, okay? So we had to appropriate that money, that has been used. It has trickled off, that followed that agenda that Joni gave everyone, a copy of it at our last meeting. She has followed that, so then,
We're wrapping up with the.
we're wrapping it up, yeah.
Darren, can you hear us okay? I don't know.
Yeah,
if
it's
this-
pretty good.
I don't know if this is a time or under new business, but, you know, we're all reading in the paper about the large amount of federal dollars coming to the community. You know, to the county commissioners as well as to the city, you know, multiple millions of dollars. Are we part of those discussions, the health department?
No, not that I'm aware of, not with me anyway.
It's the Vigo fund, no, the COVID fund.
Well, there's a wide range of them, but like $30 million coming to the county and 20-some million coming to the city. And, you know, we,
I think you have to speak louder.
okay, well, it's a thing there, you know, where there's like $30 million coming to the county and 20-some million to the city. It's been in the paper about every day. And people are meeting to decide how the pie is going to be cut up. But, you know, we've been chronically underfunded as a health department. I mean, Indiana's 47th in funding health departments, or 48th. So I wonder if we should have a seat at that table, or is that all done?
No, it's a good question. Nobody, I've not been polled about it or anything. No one has said, hey, you want to come and chat about these things? So I haven't heard about it from Joni either. So
And I know Joni
I would assume we're not being invited.
Well, okay, maybe we need to
Maybe
look
we
into
need
that
to
a little
look
bit.
into it, yes.
Because,
Yeah.
it's a lot of cash.
Right.
And our health department did such an outstanding job during the COVID time, and so much stress for everybody, and really did an outstanding job. And now we're at zero, to my knowledge today, zero hospital admissions for COVID. So we can talk about that in Joni later, or all of this.
Yeah, no, yeah, no, it's a very valid point, Jim, for sure.
Because we could certainly use more personnel, and we could use them everything, really. So, anyway, anything else on the financial report? Darren, you want to give us the health officer's report, please?
Well, thanks for letting me be there virtually today. I'm not scheduled to be working while we have a health department meeting, but it just did not, so my apologies. So connection on your end is not terrible, and you can hear what I'm saying here. So I don't have a whole lot to report. You know, obviously winding on this end of things as far as the attention internationally, those to the BA2 subvariants, and whether or not we're going to see enough in people not coming on the next on the just see what that's data thing. Every time I get a chance to talk to you guys as a group, I want to obviously extend a line of thanks to everybody who's done such an amazing job through all this. And people that are in the room, you're too far out of focus for my old eyes to see who's there, but I think guys down just reviews from people in the community about the job the health department did in past tense they could do. So outside of that, I've not really had any conversations. So
Yeah.
Call in.
Are you there, Dr. Bracken?
yeah, did you lose me?
We did.
Okay, sorry about that. I'll listen into the meeting. I'm sorry for the bad connection here.
Just curious, do we have plenty of vaccine and boosters and so forth?
Yes.
People want them? Okay. Are we getting much interest in boosters, second boosters?
Oh, yeah, for the past couple of weeks, that's all we've been really doing, our boosters.
Okay, great. I got one. Anybody? Want to say something about my age? Right, it's based on your age, right? Is it 50 or 65?
About
50.
50.
Well, that's not so bad. I'll
Is it still free? Oh, yeah.
Yeah.
Okay, so I thought I saw something that where some of this is gonna start costing again, some of the community, but I didn't know. Yeah, it's still free.
Anything else for there? Under new business? Wanda, did you want to introduce our guest?
You can.
So what, how would you introduce yourself? If you like, okay? Everybody wants to do it.
You wanna go? Okay, yeah.
Okay, yeah, so my name is Autumn Strong. I'm with the Indiana Golf Office. And then kind of built under that, we have what's called the Indiana Golf Foundation and then First Tee Indiana program, which is what the health department has helped with the fund, and we just kind of wanted to give a background of kind of who we are, how appreciative we are, and kind of what we're going to be doing with the money. So thanks for having us here tonight. So part of the grant was just kind of showing how golf can be a vehicle for healthy lifestyle and getting outdoors and getting kids active. So I'm going to kind of speak just real briefly to the big picture of what First Tee is, and then Mike Harding will speak to, as the local chair here for Greater Terre Haute, kind of what we're doing with the grant money and just kind of local information. So kind of at the big picture, so First Tee Indiana, it's a local statewide chapter under a national organization called First Tee. It's essentially a youth development program that uses golf to teach life lessons, core values, healthy habits. So like I said, we're a statewide chapter, and we have 18 different programming locations, Greater Terre Haute being one of them. They came on with us in 2019. So being a statewide chapter just means anything under this First Tee kind of brand umbrella is kind of with us at our state office, which I'm located just in Indianapolis area with Indiana Golf. And so 18 programming locations. There's kind of three main components to First Tee. There is the school program, which we're in 325 elementary schools across the state. That means that PE teachers are using plastic modified equipment in their PE classes, teaching kids the game of golf with big plastic clubs, tennis balls, Velcro targets. And then the big thing with First Tee is the curriculum that goes along with that. So core values, healthy habits start in those PE programs. The second thing is what is called the community programs, and that's where we implement kind of the same equipment, but we do that at Boys and Girls Clubs, YMCAs, community centers, Girls Inc., just any kind of community partnership that you can think of. We can kind of, we were kind of reaching into the adaptive golf kind of programs. In Lafayette, we work with To Be Stars, which is kids with disabilities. So just anything where that equipment can kind of go outside of those schools in that community center environment. And then the third component is really where we try to make our largest impact, and that's transitioning those interested kids from the PE classes, the community centers, and getting them at what we call the green grass, which is actually at the golf course. A lot of times we have programs where, kids aren't ready for the real club, so we still have, modified equipment out there if needed. But First Tee is a program. It starts at age 7 and goes to 18. It's kind of like Eagle Scouts. You kind of progress through the program. You can start at any age, and it is age-based. So kids, not really about skill with First Tee. It's really just about having a good time, being with friends, and really what goes beyond the game of golf, good citizenship and all of that stuff. So, but kids can progress and technically, graduate from First Tee, but they can really start at any level. Also, when we see them at those green grass facilities, they have national opportunities with First Tee, depending on how long that they've been with us. So there's scholarship opportunities. There's opportunities to go to big national golf events and kind of get behind the ropes experiences. So First Tee is a great program, really for any age, any skill level. We do have kids that end up playing more competitively. We have First Tee kids that end up playing in college, but that isn't necessarily like the main focus with First Tee. And there's also different ways that you can coach First Tee. So obviously you can be a volunteer, but with our connection with Indiana Golf, who I work for, we're also the Indiana Golf Association and the Indiana Section PGA. So a lot of times PGA golf professionals who teach the game of golf out at these golf courses, we encourage them to convert their programming to First Tee programming. It's like, you already got a junior programming going on. Let us help you with curriculum and lesson planning, and really anyone can teach First Tee if they're teaching the game of golf. So it's a great program, and we're so appreciative of your guys' support. Who really put in the work obviously was like Joni and then Mike Harding. So I will let him speak to like the local impact here.
Okay,
Thank you.
my name is Mike Harding, and I lived in Terre Haute when I was a kid, played golf at Ray Park. Yeah, I'm president of Friends of Ray Park. And I know a lot of my friends, the poor, Ronnie, I played a lot of junior golf. When I came back from Evansville here in 2014, somebody asked me to be a board member for the Indiana Golf Association because they didn't have one in Terre Haute. I observed they had about 10 people, 10 kids in the junior city. We just heard a report about Terre Haute. You guys haven't had any input about your health, and your health ranking, county health ranking, is just right at the bottom. That's really the thing about Ray Park. So we have 2 programs that we're kind of interested in. One is the development of Ray Park into a healthplex, which I'd love to come back and talk to you about. I was an assistant superintendent for curriculum instruction, as the Southwest Indiana area for a small school board, Pike County. And I lived in Evansville, though, and I saw that city grow. Health is the #1 thing here. You guys are right on the firing line, and I'm sorry to hear that you don't have any input as to what's going on with the health and the spending of that money. But anyway, I had talked to the school superintendent and about Ray, and also about First Tee, and he said, let's get it in every elementary school. So we're in all 16. I think there's 16 elementaries right now. So I came to a school board meeting. Joni's on the school board, and later I got a phone call after I talked about First Tee and Ray Park a little bit. She said, I've got a grant to be perfect. So we sat down and we wrote about a 10-page or 11-page grant. All of them was in on that, and a couple other staff members, Lucy and Allie. And so basically we started out with K through 5 here a couple of years ago, but now we're moving into the middle schools. So there are 10,000 children that are taking PE through their physical ed classes, which is great. And then I sat by a lady in Rotary. Her name was Pamela Malone, and she is a community advocate. She suggested, I came out of a really impoverished background, and she's a doctor now. She's got her doctorate, very successful. She said it'd be great if we could have it. And I think she's partial to Rives Hall. So we're not only are we in the schools, but we're in all the community centers now as well, with the money that you're providing us. That's the YMCA, the Boys and Girls Club, Rives Hall, Casey, and Camp Navigate. So we've got a lot of kids that are learning about the game of golf. And of course, I think Maury talked about this first tee program is character development and healthy living habits through the game of golf. The golf pros are all, we had a meeting in February, organizational meeting, and we all get along. It's great. All the golf courses are involved. There's 6 of them. The community center group came, and the school corporation, 2 people or 3 people. Dr. Hayworth was very supportive. You know, we needed his okay right away. We got that, and we've worked with Dr. Finn and Dr. Mason, Stacy Mason, secondary. So anyway, we envisioned golf in the first tee, and I would love to come back and tell you about this HealthFlex idea about turning the 50 acres that are in front of Ray Park. You know, that's a wonderful place. If you think about the high school, the Westminster Village, the hospital, the business area, and to have that old historic Ray Park as a social center, and all that 50 acres developed for lifelong sports like golf. And even maybe I'm working with Y on a survey about maybe possibly moving the Y out of Fairbanks Park and maybe placing it somewhere down south where they could help manage the complex out there, 50 acres. And we've made some field trips to Evansville to see what they're doing down there. So anyway, that's first tee. We appreciate what you've done and giving us the money. And if you have time sometime, I'd love to come back because I think the mayor's ready to make a move on Ray Park. He'll be announcing something probably. Thank you.
I was telling him very briefly, my nephew's a golf pro who went to Turtle North, went to graduate from Franklin. And kind of a quick story, but his first job was in Houston, Texas, and turned out to be President Bush's country club. So he got to know George and Barbara and began dating Barbara's personal assistant, Quincy, and they got married. So we all went, they went and had the wedding at their house. So it's like a comedy skit. The Turners, we all went to Katy Buckford, Maine, to the Bush compound for the wedding. George, Barbara, Jeff, and the Turners. It was a comedy skit for sure. But anyway, Quincy then went to work for Laura Bush in the White House. She was actually there on 9/11. JT worked at Burning Tree Country Club outside Washington. And then he's now the head pro of the Country Club of New Orleans. He plays golf with Peyton Manning and that whole family belongs to down in New Orleans. So golf can take you a long way. He sent me a picture a few weeks ago, and I hadn't seen him before. He's on the 18th hole with President Bush, Chief Justice Roberts of the Supreme Court, my nephew, and Arnold Palmer. That's a pretty good force.
And he started out at Ray Park.
Started out Ray Park. It was just like this big. So I've had personal, I'm not a golfer, but I've had personal for my nephew. And pretty far. So thank you.
Yeah, thank you. We're about to leave, but we really appreciate your help and we'll give you an update. And don't forget about the Ray Park Health Plus.
When is the grant cycle, like?
It's for basically it's for this year and then the next 2 years.
So we'll do a report, like December, January, and then
The money's going for basically for equipment to be part of the national organization. Once you pay the fee, you're a member of First Tee Forever, which is great. Training of all the PE teachers, because that's how we deliver the program basically, and some of the administrators. And also, I think you talked about equipment and program fees, that type of thing. But you've got everybody on board now. It's very rare. And I think Lucy, we work with IGA, she said that our community with the schools and the golf courses and the country club, they've been really great. So we've really grown really quick. Just think about how many people we're impacting with the money. It's great. I want to say, you know, I'm just turning 70. I can go out there and walk Ray Park, no problem. Play it, walk it, and stay in pretty good health. And that's what your business is.
thank you very much.
We're going on now to old business, updates on the COVID response.
Is that Linda?
Anything new?
Updates on the COVID response? That would be the nurses or Linda? Linda, do you have?
Sure, as far as what we're doing with the. Yeah, so we are starting to see an increase in COVID boosters being administered at the clinic. The past 2 days, we've had people in every 10 minutes for the whole day, so that's very, very good on their part to come in. We also still go to Gibraltar once a month and do their COVID vaccines for them, as well as we go to the community corrections. We haven't gone to the juvenile center and we haven't gone to the jail for a little bit because they come and transfer the bodies to them and they do their own. So we're seeing it pick up again. And I know Chelsea isn't able to be here tonight with you, but I know this morning when she came in and looked at the positive results as of this morning, there were 13 new cases this morning. So we're seeing an uptick again in COVID. And from the testing that was done, it is the new variant that's here. So we just have to be on the lookout for that again. And that's about all I can say unless I can entertain some questions.
And then in the packet, we also have Ann Stamper, who was heading our health awareness grant. She's put her report in there on all the things that she's been doing in the community as far as the mobile clinics and all of that and the outreach that she was doing. She was doing the Hellbound, which their grant's wrapping up, so that's been handed over to our nurses to complete the Hellbound list. Anything else that you can think of? And I know they're wrapping up on their mobile clinics because the grant's soon to close up and yeah, so she's put it all in a nice report and you get a chance to read over that.
We're not masking anymore, right? No,
We're not masking right now. No, I'm masking right now because my husband has leukemia because he has CIDP. So yeah, I have to, so I don't take anything home to him.
So we have the variants now here in town,
Uh-huh.
but there's no, Dr. Dar, you said there's nobody in the union, right?
Is it activity right now? Is it a hospital activity?
Yeah.
We have a maximum one time.
Oh, I don't even know what the numbers were. There was, we've had one or two for the last few weeks, but then.
Well, we've really seen like it's influenza A and B over the last maybe month, 6 weeks, mainly school age children seems like taking it home. But I don't think we're really admitted anyway to the hospital. It's a wide range of headache and body ache, but I don't think people got that sick. We didn't, maybe a rare vomiting, get some IV fluids, but I don't think anybody's died from.
I had one this morning come through.
I'm sorry.
I had one death certificate that had influenza A listed on it this morning.
How old?
Not off the top of my head. And
Interesting.
that was just,
So we're still have to be vigilant.
Yeah.
So the FYI, only the new pills that's free, that you can e-prescribe, the molnupiravir and Paxlovid are very effective, you know, prescribed 2 times and as long as you give it within 5 days of diagnosis.
Yeah.
It really, you know.
And I think it's almost free.
Oh, it's free, it's
Yeah.
You
free.
get it free, so.
You take it for 5 days, twice a day for 5 days, and so if any of your family had COVID, you know, it's a tool, so, you know.
And then really, Jimmy, the monoclonal antibody, this is really not very good for this variant, right? What we use in
But
monoclonal antibodies, people only got the injections and so forth. This virus really isn't sensitive, is that right, to the IV drugs that we have?
Yeah, that's what they've shown us.
But the
yeah, but
pills-
you have to do that in the hospital, the pills is do it at home,
Oral
you know,
medication is effective,
it's
so
very
it's
effective,
actually easier, cheaper.
it's free.
There you go. Tax dollars at work. Thank you very much.
No, thank you.
So, the vigilance continues. Is there any other old business? Program updates, health education, please.
Did the nurses need to go first?
Yes.
The nurses need to go first.
Okay, whatever, that's good.
So,
I married one.
We have our report, so it breaks down at the top the clinic patient scene. So 685, and that includes physicals, TB tests and reads, vaccine record pickup, vaccine appointments, and lead and hemoglobin testing, which is free. Also, the doses administered, I broke it down as the COVID-19 total, both pediatric and adult. So the numbers that we get from CHIRP and what we have on Zotec, which is the program that we use to enter in everything for the COVID-19 vaccines, is a little off. So in total from CHIRP, which is the immunization registry for the state, would be 1384, but that also includes the mobile clinic as well. So, and then, like I said, it just breaks down VFC, which is the children from 2 months up to 18 years, for 18 years. Adult, private, and then our employee vaccines. There's our TB activity. We've seen an uptick in tests given. Twyla has 5 latent TB active cases, and then our lead cases as well. So I actually, over the last couple of days, I've been kind of working on our lead cases. Some of the guidelines are going to be changing as of July, so they want us to go ahead and kind of start closing the cases that are not actually cases. So right now, anything that's 10 and above is case management case, where we have to go out to the house, talk to the doctors, have them retest, things like that. But any test that I get back, I send out a letter. I talk to the patients, I talk to the parents, I talk to the doctors. So the 9 that I was following are actually closed. They're closed. You have a breakdown of the communicable disease investigations, which Twyla and Chelsea had for that, and then our nursing activities. So we're not doing the naloxone grant this cycle, so we're just doing referrals for those. There's a breakdown on that next page for our services offered, which has not changed. Like I said, the COVID-19 vaccine is still free, and we are seeing an uptick, as Linda had broken down. We did some training completions over this quarter. Chelsea and Grant, who his last day was Monday, they're still coordinating the case management, the contact tracing, which Chelsea has been calling the patients and just letting them know that they're positive, and then providing any type of answers that they may need. Linda and Robin have been kind of heading the COVID response with administration and coordination of the vaccines, along with the rest of the nurses here. But they also go out to Jabal, like Linda said. They haven't been out to the jail, but they have been to community corrections, and just partnering with the state and long-term care facilities to transfer the vaccines to them as well, just to make sure that they're vaccinated. And then Twyla will give you an update on an event that's going on at the end of the month. We've been busy, so yeah, we've done a lot. So.
Go to like White House Mission or Coda or Bethany House or any of those places that are homeless shelters.
I don't know. Yes, we have. Yes.
Yeah. I think the mobile clinic actually hit some of those places when we were in the heart of winter, when it was getting sub-zero, and St. Stephen's was having, we went there for 3 nights in a row. And then we also went to the soup kitchen at St. Ben's. Yeah.
And the TB cases, will that mean the immigrant population, like students from overseas?
The LTBI is students, and obviously they're from other countries. So most of the LTBIs are students. Sometimes people that work at the hospitals get referrals as well. So we've had some native born, but the majority are from out of country. And I was just going to give you a brief update. We're going to be partnering with the Y. The Y asked us to come out and do a vaccination clinic. It's going to be April 30th, which is this Saturday, but next. It's gonna be for ages 5 through 12, and it'll be regular vaccinations as well as COVID vaccinations for that age group.
Okay. Guys, we wrapped up last quarter with getting all of our tattoo places submitted. Tattoo artists, renewals, food establishments, renewals on the permits. You can see in the numbers how many permits we've issued. We've had an uptick in mobile trucks this year. So it seems like we're getting 2 or 3 applications every week for people that are wanting to open a food truck. So that's keeping us busy. Loretta and I, let me go back. Septic installs, Steve's still extremely busy. We have a vacant spot on that side, so he's doing the work of 2 people right now. Rhonda's helping out where she can. A lot of requirements are going out the door. People are doing soil reports. And Ron and Steve are having to come up with the requirements and send them out. Now, whether they follow through with putting in the system or not, but that still takes time. Let's see, Loretta and I attended a leadership conference, which was very beneficial. We really enjoyed it. Amanda, we have a new employee. So Amanda Schick is one of our newest environmentalists. And her and I just completed the certified pool operators course. She will be going on to take the lead training in June so that she can be a lead risk assessor. With all of that being said, our plan is to get everybody completely cross-trained. So, you know, we're environmentalists, but we have septic, we have food, we have tattoo, we have the pools. And I want all of the employees to be thoroughly cross-trained to be an overall good environmentalist. I'm going to start going over our ordinances in my division, just to make sure that we're up to speed on everything that needs to be. There may be changes that will be coming down as I see fit. As of May 9th, I will have 3 vacant spots. So if you know anybody that needs a job, send them our way.
What are the minimum qualifications?
So they have to have a bachelor's degree. We prefer something in the science field. Environmental health would be great, but yeah, science field. Okay, any questions?
Somewhere or other.
It is posted. We have a posting on our website. And that goes, when they post it, it goes on to Indeed and a couple other sites for jobs, but I've had 8 applicants. So filling those positions is kind of hard. So I thought I might throw it out there if anybody knows anybody, have them turn their resume. Okay, any questions? No? All right.
Thank you. Thank you. Can you help aware this grant?
Anna's not here, but she, her report, which is what I talked about a while ago. So.
Mike, that was you, Paul?
Emily, want to go ahead?
Okay.
Okay, I can.
I was going to say.
I
was watching the door and watching you. I mean.
Hi, I'm Emily. I'll be the new health educator at May. I'm a public health student at ISU right now. So I've just done a couple of things so far while I'm shadowing and stuff. So I've done a couple of interviews with the news. I put out a couple of PSAs so far. Not a whole lot right now, but I look forward to doing more.
She's been bouncing around from division to division to kind of get an overall view of what everybody does.
Yeah. So
She's taking it all in.
So you graduate in May?
yeah.
Are you local?
I am.
High school here?
Yeah. We're all out of sorts, Dr. Kern. We're all out of stuff.
Yeah, we're all. Mike, go ahead.
Be more than happy to, Doctor.
Okay.
Good afternoon, everybody. We've been pretty busy. David Higgins and Logan Edwards and myself attended the IBCA conference in Jeffersonville, Indiana on March 7th through the 8th. A lot of good information came out of it. We finished up all of our vehicle maintenance, all of our equipment maintenance. We have a schedule to get our equipment certified May the 2nd. We've ordered all of our chemicals for this year, which price went up, so thank God the council did give us a little extra in our budget for that. We started tar amnesty May the 4th. And no, April, yeah, April 4th, which will run to May the 6th. We've already filled about 2.5 semi trailers. So we're averaging about a semi trailer a week. It's a little slow because Mother Nature's been not providing us the best weather. As Dr. Lim had said earlier about spring, it's not here yet. So we'll have to wait and see how that finishes up. But other than that, we're staying busy. We're getting ready. Anybody have any questions? All right, thank you.
Like say, if we do get any extra money, I would love to replace his vehicles that he's asked for like every year. That he's don't want. How old are they?
We keep trying, yes, we keep trying.
Yes.
We put that out there. It's out there every year.
Yeah. Maybe we need to start a campaign.
Should be good trading value right now.
Right.
I don't know, they're pretty old. I don't know.
It's difficult to order a new one. I actually have three
Yes.
vehicles ordered, and so far 2 of them have been ordered, and the third one is still up in the air.
Wow.
The
Yes.
truck, the dealers just, they can't get the parts to build them. With war and everything going on over in Ukraine, and
Chips.
it's got everything really topsy-turvy.
Is there any more nursing report? Or are we done with that? Or is there more?
We're done with nursing. We got Loretta left.
Loretta, please, vital statistics.
I don't have a lot, but over the last 3 months, as you see at the report, our birth numbers and our death numbers have went up and down. We're still busy in the office with our court orders, our PAs, our adoptions, answering the phones, the daily note, conducting the business at the window with the public, getting their birth and death records that they need. We did have an employee that transferred over to the courthouse, leaving us with a vacant position that we did fill with our part-time employee. That's about it. Anybody have anything? We did put on the, that you asked for last time, that in and out. Did you want anything else on our report?
No, that's fine.
Okay.
That's kind of interesting.
Yeah. Yeah, you did see how it goes up and then down and up on the birth and the death, and with our, everything else on there. If you guys have any other questions, or if you need anything else on the report, just let us know.
Okay, thanks for
You're welcome.
The influenza death was a 85-year-old female that passed away in the Gibson Family Hospital Center on April the 9th.
Any citizens input this evening? No. The next board meeting will be July 20th. Anybody anything to add? Or wanna say anybody anything to-
Would you like for Brooks COVID stuff to be start putting on their reports?
I think that'd be helpful.
Okay.
Because
What would you like, what information would you like from the COVID?
what comes to you, is it ages or numbers?
I mean, we used to break it down by gender, age.
Maybe something like that.
Okay.
Maybe over 10 decades or something like that.
Okay.
Because the variant's here, and so we'll have to see clinically how bad it is and how long the vaccine's done. I question with influenza, whether the vaccine's given in the fall, they're still working. I don't know, I've never seen reports on it from in the literature, but whether we're still getting any immunity from that. And that's maybe why the teams are kind of late this year, really. It's been a funny year besides COVID. RSV was a funny thing, came in the summer. Not in the winter. So, but I guess our mission is to stay vigilant and get people vaccinated, gee whiz, because.
That's what I wondered with the COVID rates.
We've seen a significant improvement come March, but January, we had 50 total deaths. In February, we had 35 total deaths, and March, we had 5.
This COVID,
COVID.
You know, nationally, I saw in the Sunday paper was, we're still losing 500 people a day nationally. And there's still 15,000 people hospitalized nationally. So that's 500 people a day, it's still a huge number. So from the theoretically preventable illness, the vaccine shouldn't be very effective. So we want to develop a diligence on that for sure. So our next board meeting will be July 20th. Is there a motion for adjournment?
Make a motion.
And a second.
Second.
Okay, moving second, all those in favor?
Aye.
And opposed? Thanks, everybody. See you July 20th.
Thank you, guys.
Open meeting.